Hello, my name is HM2 Ansel. I'm the Suicide Prevention Coordinator for NOSC Sacramento. I'm just going to be making a brief video explaining what the SPC program is and some resources that we offer. Obviously, SPC is Suicide Prevention Coordinator. Suicide is obviously a very important issue in the Navy that we deal with every day. So I'm just going to talk about some tools that you can use and kind of what the program stands for and how to approach a potentially bad situation and do the right thing so that somebody gets, life-saving intervention. So obviously most of you are familiar with Ask, Care, Treat. That's the acronym that we currently use to kind of gauge what situation could be potentially suicidal or bad versus a situation that would not be like that. So ask obviously is you realize that someone is not acting like themselves. They're acting a little strange. They're sad. They're not, in the mood that they're normally in, whether it's they're actually saying I'm not okay or they're kind of exhibiting behaviors that are not normal. The ask part would come in where you actually ask the member, are you okay? Are you contemplating suicide? It's not necessarily the easiest question to ask. It can be a little nerve-wracking, right? Not everyone's in necessarily the outgoing kind of bold state of mind, but you really do need to be in situations like that. So if you don't feel comfortable asking someone by yourself, but you know that they need to be addressed and ask those questions, then obviously don't leave the person alone, but grab someone else, whether it's one of your LPOs, somebody in unit leadership, right? One of your friends. There's nothing wrong with grabbing someone else to kind of help you along the process because it's definitely not an easy question to ask. But again, ask is going forward and being specific, going to someone and saying, hey, are you okay? Are you thinking about committing suicide? Are you in a good place right now? What's going on? The care and treat part come in. That's kind of where the medical department and maybe a chaplain will come in. So the care would be bringing that person, right, escorting the individual. If they say, I'm not okay, I'm not in a good space right now, I am thinking about doing something, you would obviously escort the individual to the medical department, and one of us will take over from there. Myself, HM1 Domingo, or HM2 Dotson, right, we're all corpsmen. We're all trained in kind of the questions to ask when we evaluate the person. And then from that point, if we feel like they are not in a good place, then we would refer them to an MTF or obviously an emergency room or hospital. So the treat portion would come in when the member is obviously getting the appropriate care that they need. As the SPC, I'll initiate a SAIL referral, which is essentially a program that is set up to provide resources to the member, different individuals in their area and their command maybe that can reach out to them and get them counseling, therapy, right, resources that they need to kind of deal with the problems in their life. So ACT is an important acronym to remember, Ask, Care, Treat. There's actually an SPC corkboard or kind of like a little hub with all the information and resources that I'm going to mention. Two of them are in the command. One of them is in the drill hall. One of them is across for medical. Those are really good resources that have military one source, fleet and family, the chaplain's information, medical's information, websites that you can go on for techniques to handle stress and kind of life stressors, because obviously we all go through stress. I would say some of the happiest people, some of the most successful people still deal with issues that can result in them not being in a good place. So regardless of your rate, your rank, your gender, how good you may seem, right? Anyone can kind of be affected by dark thoughts and suicide. So definitely don't feel like there's a specific person that fits into a mold that, if they don't act this way or if they don't exhibit these behaviors, they're not suicidal or they could never be, because that's definitely a myth and kind of a stereotype that's not accurate. So those two cork boards that I mentioned are really good resources, one across from medical, one in the drill hall. If you want some more resources online, suicide.navy.mil is a really good resource. If you're an SPC yourself, or if you're just wondering more information about the program, whether it's tools that you can use, things that you can print out and hang around your command or your unit spaces. There's a lot of resources, posters and things of that sort that are already around the command. But suicide.navy.mil is a really good resource I use all the time. There's a SPC toolbox and a handbook and just a bunch of really good resources there. But yeah, I like to say, really just get to know each other, get to know the people in your unit. because if you don't know somebody, you're not really going to know when they're not in character and they're not acting like themselves. Obviously, at the end of the day, we're all here for each other. We're a family. It might not always feel like that, but that is the case. And I know that I would be here for any of you. I'm assuming that all of you would be here for me as well. So get to know each other so you can really tell when someone's not acting like themselves and when you might need to ask those hard questions and refer them to medical. Worst case scenario, if you're not at the command or you are not with your unit or in a drilling status, but you happen to be around somebody, if worse comes to worse and you feel like they're in a situation where they could attempt suicide, they have suicidal thoughts, they're just not in a good place, there's nothing wrong with calling 911 and getting the person referred to an emergency room. They might not like you for it, but honestly, at the end of the day, them being a little irritated at you is better than potentially leaving them in a situation where they can cause harm to themselves or others. So 911 is always kind of a last resort to getting somebody to an emergency room and getting them the care that they need. I mentioned a chaplain earlier. Obviously, out of all of the resources that are kind of in the SBC program, the chaplain is going to be the only 100% confidential resource that a member has. So anything that is said between that member and the chaplain does remain 100% confidential. That chaplain can't go out and just tell anyone about it. So if somebody needs a resource that they want someone to talk to, they don't want to go out to Fleet and Family or any of the other places that offer counseling, a chaplain is obviously always available. Their number's on the board. But again, just keep in mind that they're the only 100% confidential resource. If you do escort someone to medical, or if you call 911, or you get them in a situation that they need to be, as great as that is, obviously some people are going to have to know. The entire command's not going to know. Obviously, the SBC myself has to know, and a few other people in the chain of command, but not a lot of people. But just keep in mind that it's not 100% confidential when you escort someone to medical, or when you call 911, or when you refer them for an evaluation. So definitely don't tell the person, hey, no one's going to find out about this. That's not necessarily the case, but it's definitely not more people that need to know. So it is limited to a small group of people, but don't let that deter you from actually getting them the help they need. If you have any questions or concerns, I can be reached at my personal Navy email, which is timothy.c.ansel@navy.mil. The medical distribution email I wouldn't recommend, because obviously it's kind of a sensitive issue. So if you don't need to let all of us know and you just need to let myself know, then that would be preferable. But that's also on the Navy Reserve Home Port, NOSC Sacramento Medical Department page. It's NOSC_SCRM_medical staff at Navy.mil. That's the medical distribution group, so that will email myself, HM1 Domingo, and HM2 Dotson. So those are some resources and some ways to reach out to us, or you can call the medical department. My number is 916-387-7100, extension 25. If you need to let me know that something's going on and you're not in the building, then that's also a way to get a hold of me. That's about it as far as SBC is concerned. If you have any questions or concerns, or you want to know more about the program, go to any of the resources that I mentioned earlier, suicide.navy.mil. That's a really, really good one if you want to become an SBC or just know more about the program. There's also a program binder that I have in medical on my desk, which is essentially has all the paper resources that I've described. Most of them are electronic as well. But thank you so much for listening, and have a great day. Bye.